Hello, and welcome to the Love Mia Vita podcast. I'm Gerianne DiPiano, CEO of FemPharma. Thank you for joining me as we discuss all things women's health and wellness. Please note that this information is simply that. It's information to help you to think through your decisions. Please consult your medical practitioner to discuss your personal situation. Thank you. It's Gerianne DiPiano, and today my guest is Dr. Nicole Swiner, who is a primary care practitioner in North Carolina. And Dr. Swiner, share with our guests and listeners a little bit about your distinguished background. Dr. Swiner is also a medical advisory council member for FemPharma, so we're really excited to have her again today.
Absolutely. Thank you so much for having me again. Hello, everyone. So in a nutshell, I have at least 15 or so years of experience in private family medicine practice, and then even outside of the clinic. And since leaving the clinic about 3 or so years ago, I've continued to do a lot of general medical education on women's health, mental health, aging, menopause, wellness, and all things in between. So that's the stuff I like to talk about.
So she has an incredible background. She's also written a book, and we call it the Superwoman Syndrome. And for those of us that understand what that means, you definitely need to take a look at the book and get some tips from Dr. Swiner as to how you can overcome this, because we do need to overcome that need to be superwomen.
Absolutely.
Today, our podcast is going to cover a really important topic. Sleep, but it's sleep and the implications for cardiometabolic disease. It's a mouthful, right? So cardiometabolic disease. So let's talk about what that really entails. It's obesity, it's diabetes, it's cardiovascular disease, it's inflammation. So it's all of those types of issues that become consequences of bad sleeping patterns.
Yeah.
Could be that you have occasional issues with sleep, or could be that this is a habitual problem. We're going to cover both of those. So when we use the mouthful, God bless.
Thank you.
Metabolic disease, we think about all these kinds of issues. So let's talk about what lack of sleep really means, and what is the first thing you think about when someone doesn't get good sleep? So maybe we can distinguish between the types of sleeping patterns, because they can be different, but they still make a difference.
Yeah. Well, sleep is definitely my jam. I called myself, the nap queen. I've called myself that on many occasions. My family knows that. Sleep is incredibly important in whatever age range you're in, whatever phase of life you're in. There are a lot of different types of sleep dysfunction, but one thing I always like to talk about is this grind culture that we celebrate, particularly in capitalist societies like ours in America. This, grind, sleep when you die, like you are, going, trying to do all the things, make all the money, et cetera. But we now know that comes at an incredibly negative cost in many, many ways: mental health, physical health, emotional health, et cetera. And this does start when we're young. If you were born in the late 70s like I was, we were the babies of the baby boomers, and we were told to, do well and excel and go to college and get that graduate degree and go to work and do all the things. But not often were we encouraged to rest, encouraged to just sit down, take a quick 30-minute cat nap, or go to bed at a reasonable hour so that you can have 6 to 8 hours worth of good quality sleep. So it was stay up all night, cram for the test. It was that kind of a thing. I feel like it's better nowadays that we're focusing on whether it's social media, whether it's, the Gen Zers telling us that they want to slow down a bit. I think it's getting better, and we're focusing on not only getting more sleep, but better quality sleep, because we know all these things health-wise that you listed can be consequences of that. So there's a lot that we could talk about.
So when we talk about sleep,
Mhm.
and we've had other podcasts where we discuss sleep, but just as a reminder, so when we think about sleep, we don't we genericize it and we refer to it as insomnia. And that is certainly one type of sleep disorder,
Right.
but there's also obstructive sleep apnea, and there are issues that impact that from a physiological and from an anatomical perspective. So we should probably distinguish between the types of sleep,
Yeah.
not that, or disordered sleep, not that it matters necessarily. The consequence of having poor quality sleep or short duration sleep is what really changes our dynamic in terms of our cardiometabolic health.
Correct. So you're absolutely right. So not only is there insomnia and sleep apnea, but there's hypersomnia, right? So sleeping too much but still not getting good quality sleep. There are things like narcolepsy. There are things like shift work syndrome. There are all types of things, restless leg syndrome, that can not only be the cause or the consequence of poor sleep, but you're right. The end result is the end result. You're not getting enough time for your body to recuperate. You're not giving your organs enough time to slow down their function and rest. You're not giving your oxygen levels enough time to really get to where they need to go. Your brain, your heart, your kidneys, your extremities. And you're not giving your body enough time, your adrenal glands, enough time to modify and balance your cortisol levels. And cortisol, being the stress hormone, is needed. It's necessary. We need it to fight or flight and to function. But if you have too much of it and you don't give your body enough time to reduce cortisol over time, that then leads to the things that lead to the things. So cortisol increases and is related to weight gain, is related to chronic headaches, to chronic hardening or tightening of the blood vessels, high blood pressure, heart disease, you name it. So we have to give our bodies enough time to get good oxygen and blood flow, and we have to give our bodies enough time to reduce cortisol. And so those are the things that trigger the bad outcomes that you mentioned.
So when we think about disordered sleep, irrespective of the type of disordered sleep, we also look at how that changes our eating patterns and what we eat. So it's not just, okay, I didn't get any sleep, and now in order to make up for that, I'm going to eat. It's how much you eat and what you eat, because it is different. So if you're getting healthy sleep, which is greater than 5, 6, actually 6, 7 hours of sleep per night. So you
Mhm.
get less than 5 hours of sleep per night, you're in trouble.
Yeah. Yeah. And, so interestingly, I mean, there have been studies that show that there are a small minority of people that can actually function, like live healthy, quality lives on a very small amount of sleep. That's very rare. So the majority of us, no matter what age, that doesn't, whether you're a teenager or in your menopausal phase, we still need a good 6 to 8 hours, sometimes even more, depending on what's going on, whether, menstruating or, recovering from illness, et cetera. But we all need a good amount of sleep, 6 to 8 hours. And you're absolutely right. It if you wake up and you feel groggy in the morning, you're in a bad mood, you've had you wake up with a horrible headache because you have sleep apnea and your oxygen isn't getting delivered, then you're more likely to make bad choices when you wake up. So you load yourself up on caffeine, which we know in very, very small amounts is okay, might even be helpful, but in large amounts, that also comes with its own list of things that can go wrong. Or we choose sugary things because it gives us a boost and we feel like it energizes us, or we feel like I just feel better, once I have sugar and carbohydrates versus protein, so I'm going to eat that sugary donut instead of getting a protein shake. We don't make the best decisions for our health because we're just tired and we want to get on with the day and we have things to do. We have to go, go, go. So yeah, it triggers one bad decision after another as well, which doesn't help us to avoid those negative outcomes.
So we've probably all had those mornings, right? Especially when we travel. So we also think about those individuals who do a lot of frequent travel, whether it's domestic or you're traveling different time zones from the East Coast to West Coast to East Coast.
Yeah.
Or conversely, if you're traveling internationally, which is even worse because now you're completely upside down. And the morning starts off with something that has lots of carbohydrates, lots of sugar, and a cup of coffee, or
Right.
God forbid, a bagel and cream cheese, which is my go-to thing when when I'm traveling, because I miss my bagel and cream cheese. Maybe I'll throw a little salmon on there so I'll get some protein, but
Mhm.
it's not the best choice. Part of that is what you just explained, which is that, you're exhausted, you need that sugar rush, you need that caffeine, and so you make poor choices because you're also cognitively somewhat impaired, right? You just
Mhm.
didn't get any sleep or you got really poor sleep.
Yeah.
And that is one of the reasons that we also see an increase in weight gain. So let's talk a little bit about weight gain, sleep and weight gain, because there's a lot of research that
Yeah.
points to significant amounts of weight gain, as much as what I saw in one study was as much as 30 pounds over the course of 16 years. Now you say, well, 30 pounds in 16 years. Well, if you started off at 150, you're now 180.
Mhm. Mhm.
And we have to think about, what is your BMI? Are you 5 feet 5 inches tall like I am? Because that could mean that you really have an issue with
Right.
obesity.
And your organs are having to push harder, right, to work against pressure. So, yes, you clearly, if you're not sleeping well, you're going to be fatigued. And who wants to think about working out or going to the gym where you're tired all the time? So, it's this vicious cycle. And I talk to my patients and clients about it all the time. Like, yes, yes, we need to exercise. You get that 150 minutes per week. That's what the national guidelines say. But if you wake up groggy with a headache and you're just struggling to get through the day, who wants to think about after a whole day of working, going to the gym or going and getting on the treadmill for 30 minutes? Like, who wants to do that? But if you're too tired to work out, you'll always be tired because you'll never get the energy from working out, right? So it's this horrible cycle. So when it comes, to weight loss in general, for people who are on their weight loss journeys and want to make those lifestyle changes and want to make better choices with their diet, with their intake, they want to be more physically active. If they're not sleeping well, then you're going to hit a brick wall. You're not going to be able to convince them to go to the gym 5 days a week because they are dog tired. So you have to fix the sleep and the energy level so that they're motivated to get up, make those good decisions with their intake, and then be motivated to go outside or go to the gym and do the exercise. So they're all interrelated.
And we know that so as we gain weight and we start to change our diet and we have poor dietary habits, we have low energy, then the consequences of weight gain, whether you eat sugary substances or not, now the consequences of weight gain also may lead to things like diabetes,
Absolutely.
our inability to control insulin and glucose.
Absolutely. Absolutely. And high blood pressure because your blood vessels are very tight and resistant to relaxation. Your heart has to pump harder, literally has to, strain its muscles to pump the blood flow to the vital organs. That causes high blood pressure, which then can cause heart disease, congestive heart failure. So it really is vitally important. We don't realize it. We know about it. We know that we should all get more rest and sleep better. But you really don't think about it until you start talking about things like this, or you listen to podcasts or read literature that really talks about the algorithm. What happens if this doesn't happen, this triggers this and all the things after it. And so if you start if you're going to pick somewhere to start, if you're on as the new year approaches, as you're thinking about how to feel better and do better, focusing on your sleep is a major factor when it comes to making those changes, because you can't really make the other changes unless you're well rested and have the energy to do it.
So sleep is really at the top of the pyramid. And when we think about, what what ensues without good sleep. So we talk about weight gain, which can lead to obesity, which can lead to diabetes. Diabetes, one of the leading causes of cardiovascular disease, type 2 diabetes in particular. And then when we think about type 2 diabetes, we also say, well, how does that lead to cardiovascular disease? And you
Mm.
illustrated that, well, you have blood pressure that instead of rising and falling, right? So falling when you sleep, rising when you wake, it's constant. And it's because it's constant, your body, your heart is working that much harder. You do have that vascular resistance. Then we have other issues. So let's talk about those other issues that, can result.
Yeah. So not only did you mention, so diabetes alone, you can think of as its own, I guess, organism. It has, tentacles and branches that branch out to almost all the the health issues and horrible health outcomes you can think of too. So not only heart issues, but kidney issues. Plenty of people end up on dialysis, unfortunately, that have diabetes or uncontrolled blood pressure. Um, what else? Neuropathy, problems with your extremities and the nerve findings and the nerve endings that serve those places because of inflammation, vascular issues. So diabetes is kind of its own class when it comes to bad things and complications that can happen. But you don't want to forget about your cholesterol. So even outside, so you're thinking, okay, well, how does sleep relate to cholesterol? Not only does sleep, of course, mention, or as we mentioned before, have to do with making the not so good choices in the morning when you get up and you choose what you're going to eat, but not only also related to not wanting to work out and uh, doing the exercises that help increase the good cholesterol, the HDL cholesterol, so it battles the bad, the LDL and the triglycerides, but you aren't working out your body and moving the blood flow along and helping those the plaque buildups to not build up, or helping those areas to not have plaque buildup. So you don't want to forget about the other areas, because you could say, okay, well, I'm not obese, my BMI is great, my blood pressure is great, I don't have diabetes, you know, 3 to 4 hours of sleep, I'm fine with that. But you don't realize that there may be other things that you don't realize are happening as you sleep, that could be getting in the way of you having a really good quality of life.
You earlier on, you talked about cortisol, and we think about those ad adrenaline and noradrenaline,
Mm-hmm.
what that does to your body when you have poor sleep. Maybe
Yeah.
we should touch on a little bit of that.
Yeah. So, fight or flight, about your adrenaline going up when you feel fearful, scared, stressed out, anxious. Your body releases those adrenal glands that sit on top of your kidneys, produce more cortisol, releases it into the bloodstream, and it's there because it can be life-saving, right? So back in the day when we were, foraging and getting our food from nature and et cetera, running away from predators, the body said, kick in, go, there's something that's around that could harm you. We still have that innately because, again, we need that in order to function and to live, but we also need the balance. So we need the epinephrines and we need the norepinephrines to help balance us out. And you're absolutely right. If your body is in high cortisol fight or flight all the time, adrenaline load, then you're not giving yourself enough time to rest and decrease that and balance it out. Your body feels like it's in constant workout mode, which is great for a short time, but over a prolonged amount of time, think days, weeks, years, your body being in constant fight or flight, constant high cortisol, constant inflammation, that's not good for anything. Not good for autoimmune disease. If you are prone to it or have a genetic predisposition to autoimmune diseases, that can trigger things. If you have high blood pressure, it's going to keep that blood pressure high. If your plaque continues to build in the blood vessels, that's going to make it harder for the blood to pump through the blood vessels. So you can see where that would lead.
And if you have poor quality sleep, or if you have very short duration sleep, you are in a constant state of You can be in a constant state of fight and flight.
Yeah, exactly.
And and those are some of the things that we don't appreciate when we think about what the implications are for lack of sleep. So it's helpful to get this under control. So I know we talked about all of the different terrible things that can happen to your body when you don't sleep and the appreciation that they lead to cardiometabolic disease.
Mhm.
And now the question, as a healthcare practitioner and physician, primary care physician, what do we do about it? So what
Yeah.
are the things we can do, starting with our sleep as the top of the pyramid?
Yeah. So, I'm always going to be an advocate for calling and talking to your primary care providers if you have an issue. I had a friend reach out to me today who was looking for a new primary care provider because he's having trouble with sleep. He's not sleeping well, not sleeping long enough. So that's always going to be the number one on my list. But even as you are working with your providers, or even before you get to that appointment, you might want to take your own assessment and say, okay, so I know during the week, I try to lie down at 10 o'clock. I try to fall asleep, but for some reason, I'm still turning over and looking at the clock, and every hour it feels like I'm still asleep. You want to jot that down and take note. Or I sleep really well from 10 to 2 a.m., but then I shoot up at 2 a.m., have to use the bathroom 3 times, and then I go to bed, because that can also be something that's getting in the way of your sleep. Is your prostate enlarged? Are you drinking too many caffeinated beverages before bedtime that are waking you up? Are you not drinking enough water and not emptying your bladder well? There are all those things that can trigger you waking up in the middle of the night, and then either trying to go back to sleep and catching up before you have to get up and go to work and school, or not being able to fall back asleep at all. Is my partner noticing that I'm stopping breathing in the middle of the night and I kind of choke awake myself with trying to grab air and oxygen? You want to talk to your provider about having a sleep study so that you can figure out if you truly have sleep apnea, or restless leg syndrome, something that is affecting your sleep at night, and waking you up in the middle of the night. So, number one, always consult with your primary care providers and physicians, but then already be taking your own assessment so that you can have that data to go into the office with to say, these are the things that I've noticed. How can we address them?
So when individuals have poor quality sleep, sometimes they will go to see their primary care practitioner. Other times they will go to see a psychiatrist because they're looking for intervention, pharmacologic intervention,
Yeah.
and sleep agents. And so the advice that you just provided to have a thorough assessment done and a sleep study is really great advice,
Mm.
because you may not need that intervention. In fact, the intervention may actually not be the right way to proceed. So those sleep studies today are less complicated than they were years ago when you had to go and stay in a hospital suite
Correct.
overnight. Equipment can come home with you,
Hmm.
and you'll get detailed instructions as to how to conduct your own sleep study, and the data can be supplied to your practitioner
Absolutely.
before you go to pharmacologic therapy. So just that little footnote, having had one myself.
Yeah, my husband had to do them too. That's right. You can do a home sleep study, have your primary care do a home sleep study, or you mentioned going to see a psychiatrist, also realizing that neurologists are sleep specialists. So not only do they deal with stroke and migraine headaches and all that, but they also have training in sleep. So you may start off with maybe talking to your primary care, who then may end up referring you to these types of specialists if you need further help. But you certainly can start with your primary care and ask them, how are my sugar levels? Let's check an oxygen while I'm in the office, or let's check my B12 and TSH, my thyroid level. If I've been feeling extra fatigued, is it not necessarily related to my sleep, but is it also either only related to an iron, or either an iron or B12 deficiency, or a low thyroid, or are all the things mixing together? So start with them. You may even, even if you've tried your own remedies over the counter, like melatonin and passion flower extract, and these things that you can try over the counter, I would definitely try to stay away from the brand name sleep drugs, And if you are going to try something that's more natural, something that's more organic. But be careful because you don't know how, those things may affect your body, or particularly if you're on other prescription medications, how those things would interact. So, if you happen to have tried those things, magnesium, glycinate, make sure you've talked to your primary about that and say, I tried this is how it worked, or it didn't work at all, or these are the effects that I had.
And pharmacologic therapy may be helpful to you
Yeah.
under the supervision of your healthcare practitioner, whether it's a neurologist or a psychiatrist. But trying the natural ways to deal with sleep. Diet is a big one. We talk about the consumption of alcohol. Alcohol is a poison. That
Mm-hmm.
I know we all like a good glass of wine or maybe something stronger, but they are poisons, and depending upon when you consume it, it can wreak havoc on your sleep.
Yeah.
What other dietary recommendations might you make? More natural ways in which to address diet.
Yeah. So you mentioned some of the good ones. That last cup of coffee, taking note of when you have that coffee or that tea, sweet tea counts, it has caffeine. Even your diet colas still have caffeine unless you're drinking absolutely caffeine free sparkling beverages. Your diet beverages still have some caffeine. So taking note of when your last intake of that is. So for instance, if I know that I'm going to have a second cup of coffee during the day because I'm working on the computer, etc., I try to, number one, if I'm going to have a second cup, I try to make sure it's decaf, number one. By the way, decaf does not mean zero caffeine. It just means less caffeine. I had to tell my 13-year-old that recently. She was like, oh, can I have decaf coffee? I was like, no, it still has caffeine. But wait till you're older. So yeah, number one, making sure it's either something that has zero caffeine or is decaffeinated. And then number two, I try to make sure it's way before 3 p.m. I tend to lay down between 9 and 10 p.m. So I know that I need to make sure that I have at least 6 good hours where I've had zero caffeine, or the least amount of caffeine as possible. Certainly don't have a caffeinated beverage with dinner, because that will definitely keep you awake, or it will wake you up right in the middle of your sleep. And then you mentioned alcohol, same deal. Alcohol is a great, what we call depressant, meaning it helps you to fall asleep really well, but then it activates you probably average 6 hours later. So you wake right up in the middle of the night and then you can't get back to sleep. So even though you think it's helping, it's not really. And then of course, long-term elevated uses of alcohol comes its own myriad of consequences too. So you just have to be really careful.
So
Oh,
when you think about it, when you think about alcohol too, think about this for a minute. The calories in a glass of white wine or red wine between 120 and 150 calories.
mm,
Lots of sugar. Check
sugar.
out the sugar content. So if you're concerned about diabetes, that's probably not your go-to drink. So be mindful of the amount of sugar that is in your alcoholic beverages. That will wake you up in the middle of the night as well. But
Absolutely.
it can also put the weight on. So we know that when individuals take an alcohol holiday,
Mhm.
tend to see a drop in their weight, because
Right.
alcohol, in spite of the fact that we see all the great commercials for it, can really put the pounds on.
Mhm.
Unhealthy. Lots of data on the consequences also for increased risk in breast cancer in women.
Mhm.
So those are some things that we probably ought to keep at the front of our mind, not the back of our minds.
Correct. And I was also going to mention chocolate. We love chocolate too. But if it's not like the purest of the darkest of chocolates, you're probably not only going to get the sugar content, but you're going to get the caffeine. And so that can trigger issues with going to sleep and other issues, chronic headaches and things of that nature. So that's another unfortunate one because we love chocolate, but it's not always good for you, not in excess.
Now, what about, so we're thinking about getting better sleep. We talked about some dietary interventions. People say, well, if I exercise, get in that good walk or a run or a bike or whatever. What are your thoughts on exercise?
So exercise is great, but that's another thing you don't want to do too close to bedtime because it's pumping up those good feeling hormones. Those endorphins are great. They give you that boost of energy and mood. But for most, if you do it too close to bedtime, within an hour or two, you're gonna be hopped up, hopped up on the good stuff, right? You're gonna feel a lot of that boost. So I would say if you're gonna exercise, you're gonna take that exercise class before bedtime. Try to get it at least 3 to 4 hours beforehand so that you can still, get that nice boost, but then you get the falling off of the endorphins so that you can rest. And you certainly want to make sure you hydrate after a good workout too, especially if you're going to bed. You don't want to have muscle crampings and that lactic acid buildup before you go to bed. So working out is great. The more consistent you are with it, the better your sleep. So if you're in a habit of doing your 3 to 5 days worth of exercise, getting up in the morning, first thing in the morning, if you can work that into your routine, the better. But exercise when you can exercise in general. Do it when you can fit it in. But if you can avoid doing it a little too close to bedtime, then you're going to help your sleep.
And then there's the all important sexual activity.
Yes, absolutely. It's a great relaxant, great mood boost, in healthy, safe situations and conditions. But yeah, same thing as exercise. It's cardiovascular exercise, an endorphin release. It relaxes the muscles, just like a massage, helps increase that magnesium, that natural melatonin, all of those things happen. I don't know if you notice, but after sexual activity, you might feel that kind of that lull, where you're just kind of groggy and foggy and may need to take a nap. But it's because the body has relaxed. And so, yes, so safe, healthy sexual practices definitely can help relax you in general and definitely can help you to have better sleep.
So we've covered quite a bit of territory on sleep, the importance of sleep, what we can do. What are the 3 or 4 tips that you'd like to leave our audience with?
That's a good one. I would say I think the caffeine one is a big one. I know just personally, avoiding caffeine too close to bedtime, at least 6 good hours before lying down is key. Creating a nice, calm, quiet environment for sleep. I like to wear a sleep mask. I close the blinds. I don't sleep with music. Some people like to have music, but I don't sleep because I like to have it nice and quiet. The whole family knows once mommy goes to sleep, everyone shh, turn it down. So a nice, quiet, calm environment. There are also apps that you can use for like white noise, gray noise, or all kinds of background noises and wind chimes and all those things you can have that helps you to have that calming and relaxing environment. So what was that one? Two. And then number three, the other thing that I do just as a busy working mom and wife is I have a notepad. I have a notepad on my dresser so that I can avoid picking up the phone if something is kind of on my mind or I want to remind myself to do something the next day. I try to avoid picking the phone back up because that can cause the lights to enter your eyes and your brain and you wake up and just you have to start all over. But if you lean over and kind of jot down a note without turning the lights on, that helps you to kind of put that note down and then get back to sleep. Not only are you getting it off your brain and not thinking about it and perseverating, but you're also not turning on bright lights that then stimulate your brain to wake all the way up. So that's another thing. Write your to-do list real quick and then go back to sleep.
So these are great tips. I love the idea of putting something down on paper so that we don't ruminate over them, because
Right.
let's face it, we wake up in the middle of the night and before we know it, we have solved the problem, but now it's 3 a.m. or 4 a.m. We can't get back to sleep.
Right.
The problem has been solved. So write it down on a piece of paper. Great idea. I am a caffeine drinker. I love espresso. So note to self, no espresso after dinner.
No.
These are habits that we perhaps take for granted, but thinking about the consequences of disordered sleep, interrupted sleep, or lack of sleep are not trivial. We just covered most of those. So it's not meant to scare anyone. It's really meant to serve as an opportunity to rethink the way that you get better sleep by making some of these behavioral shifts. And as you said, first step, check in with your HCP, healthcare practitioner.
That's right. Absolutely.
Nicole Swiner, Dr. Nicole Swiner, thank you so much. It's always a pleasure to have you join us on the Love Me Avita podcast. Until next time, take care. Thank you for joining us on the Love Me Avita podcast. Love Me Avita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and check out our website at fempharma.com. Remember to live well and love me Avita.